Good morning, myself Dr. R.P Diwakar. Today's I delivered the lecture that is the avian influenza, that is most important in field condition. How the birds or the other animals suffering from the influenza. First of all, the introduction. The avian influenza is a viral disease of domestic and wild birds characterized by the full range of the responses from almost no sign of the disease to very high mortality. There is no sign, but the mortality is very high. The incubation period is also very and ranges from few days to a week. Around 3 to 7 days is the incubation period. What is the etiology of the avian influenza? Influenza virus A, genus Arthomyxoviridae family. They are enveloped negative standard RNA virus. Influenza A virus can be divided into 15H hemagglutinin H antigen and 9N neuraminidase antigen. They are, because of this region, the every year they make the different type of the combination H and N antigen and create the disease in animal and also in the human. The extreme antigen variability brought about by the genetic reassortment in the host cell. Due to the mutation, antigenic shift and drift, they can cause the infection to the animals and the human also. What is the host? Distributed throughout the world in many domestic birds, including the chicken, turkey and ducks, guinea fowl, pigeon, quails, and also in the feral birds population. Duck may be infected, but they cannot show the sign of the symptoms or the clinical sign. Even the bird is suffering from the disease, but there is no clinical symptoms in case of duck. How the disease is spread in the birds? Some important parameters, that is the movement of the man or the pupils, animals, equipment and the vehicle. These are the most important parameter which cause the spread of the disease in birds. Contact with the neighboring flock, contact with insect, rodents, stray animals and pets. They may also be a cause of the infection. Contaminated feed and water, and one most important, that is the inadequate cleaning and disinfection. How the disease is spread in the human? Because the influenza is the zoonotic disease, you can say, suffering from the human also and animal as well. So the some of the H and N antigen which is found in the animals, they may also infect the human. In human, there are some important parameters, that is the direct or the indirect contact with infected duck, wild duck and chicken through infected aerosol discharges and surface. There is no risk of transmission of the H1N1 virus to human from raw, chilled or the frozen poultry foods. There is no evidence of human to human transmission. There is a now till date there is no evidence that the human from human to human disease is spread. What is the pathogenesis of this disease? That is the localized infection mild to moderate disease, intestinal, wild duck, sore birds, the poultry, respiratory, humans, respiratory, that the uh, respiratory sign is found in the human, swine, horse, poultry, domestic duck, seal and the mink. Systemic infection, there is high mortality in the chicken, turkey and other birds, gallinaceous birds. Systemic infection is rapidly fatal disease of poultry. Only H5 and H7 subtypes are recognized to cause highly pathogenic avian influenza. Highly pathogenic avian influenza. HA cleavage site, critical virulence factor. The low pathogenic, that is the H5 and H7 avian influenza virus, can mutate into highly pathogenic form of the virus. Low pathogenic avian influenza virus or H7 transmitted to poultry. Low pathogenic avian influenza virus circulate in the poultry with mild disease. LPAI, low pathogenic avian influenza virus, mutate to high pathogenic virus with severe disease. There is a protein is cleaved into HA1 and HA2 subunit by host protease. Cleavage of HA is necessary for the virus to be infectious. If HA is not cleaved HA1 and HA2, then there is mild infection. What is the lesions? Less pathogenic virus. There are two types of the lesions you can find. Some of the virus, that is the less pathogenic, and some of the highly pathogenic. So which of the less pathogenic virus? So the mild lesion are observed in the sinuses, characterized by catarrhal fibrinous, serofibrinous, mucopurulent or caseous inflammation, edema of tracheal mucosa, thickened air sac with fibrinous exudate. Highly pathogenic virus may show there may be no prominent lesion because the birds die very quickly before gross lesion can develop. Before developing the lesion, this is a type of acute death. However, a variety of congestive hemorrhages, transductive and necrotic changes have been observed. This you can see in this figure. There is congestion and hemorrhages. What is the sign and the symptoms in the birds? There is sudden onset of severe illness. In the flock, you can see that the most of the birds are suffering from same type of disease. Severe depression, inappetence, drastic decline in egg production, fetal edema with swollen and cyanotic comb and wattle, petechial hemorrhages on internal membrane surface, sudden death. And sudden death, you can say the mortality reach up to 100%. In this figure, you can see the sign and the symptoms in the birds, and the sometimes whole flock can suffer and show the 100% mortality. In human, the symptoms, that is the initial symptoms, are the fever, myalgia, sore throat and cough, conjunctivitis in some patients, persistent high fever, viral pneumonia, respiratory distress syndrome, and multi-organ failure. These are symptoms are seen in the human being. How to diagnose the disease? The most important, that is the clinical sign, but the clinical sign may confuse with the other disease also. Sometimes you can find the same sign and symptoms to the other bacterial and the viral infection. So the important is to go for the virus isolation and characterization, then serology test, then PCR, histopathology, and immunochemistry. How to control? The first of all, the most important that is adopted in all the viral disease or the bacterial disease, that is the cleaning, and the dirty area should be well defined, thoroughly clean and disinfectant all the equipment and the vehicles, entry and the leaving the farms, have a designated cleaning and disinfecting area, pest and rodents control program, proper disposal of the damaged egg, dead birds, litter or manure. These are the important parameters by which you can control the disease. Thank you.